everybody, and welcome to DE Business Lab. I'm Dr. Pam Maragliano Munez, Chief Editor for Dental Economics. And with me, back by popular demand, Kendra Sellers of Tips Medical Billing. Kendra, welcome.
Hello, how are you? Happy New
Oh,
Year.
happy New Year to you. And I have to ask you, how are you doing? And okay, everybody, I'm friends with Kendra on Facebook, so I get to see some of the behind the scenes things. And you had quite an event with your puppy, Emma. Can you tell us about that?
Sure. It's been quite a whirlwind. My little 5.5 pounds, just a little peanut, Emma. She's a miniature Yorkie. Right before the Friday before Christmas, I brought her, actually the Wednesday before Christmas, I brought her in. She was having a little bit of a problem on her left side, felt like it was maybe something with her, maybe her leg, her shoulder, maybe even a tooth problem. So I brought her in and my vet noticed a huge mass on her tummy. So all of a sudden we shifted from whatever was going on in this left side to her tummy. And there was a large mass that was hard. And my vet was like, immediately, we need to take an x-ray. And all you could see in her stomach was looked like spaghetti, only fatter in diameter. And she said, wow, I don't even know what that is. She does need her teeth cleaned. Let's get her in for that on Friday because I just had an opening. But she said, if I take an x-ray on Friday and that mass is still there and hasn't passed through her system, we need to do exploratory surgery. So lo and behold, Friday comes, nothing's passed, and they have to open her up. Um, so you can imagine it's like nobody knows what it is and all these things. She said, in the meantime, she was eating fine. She never misses a meal. Uh, she loves her food. And so, she seemed to be fine. So we knew we could wait, but she said, if for any reason she, starts to decline or anything, you might want to call around to some of the ER vets and check to find out what is it going to cost to do an ultrasound. What would it cost to maybe do a scope? Maybe they could go in with a scope so I don't have to do exploratory surgery to pull out whatever's in there. So I called around to the ER vets. And in that, of course, I had to ask more questions. But the ultrasound was going to start at $2,000. They wouldn't even give me a fee on the scope. A CT was going to start at 1,300 and go all the way up to 3,300. Just to walk through the door was going to be about 300. Let alone a lot. We had already done quite a bit of blood work and things like that at my vet that it could have transferred over. But, I was just like, wow, this is crazy. This is going to be a huge expense if we have to go the ER route. So fortunately on that Friday, they were able to do the exploratory surgery and, instead of a little tiny hole in her tummy, they ended up opening up her whole stomach and part of her intestines. And lo and behold, found 25, 25 hair ties in her tummy. I don't even know how a dog that size could eat 25, let alone one, and not choke, throw up, whatever. I don't know how she had room to even eat and hold food. I don't, it's like a miracle. So yeah, she was quite an extensive surgery, like right before Thanksgiving. I just kept her sedated all weekend because we had, our family, our kids coming home, and we have 4 kids and 2 dogs, 2 cats, a bunny, my son and his wife, coming in with their 2 big dogs. I'm like, I just need to keep this girl calm because there was, no jumping, no running, no anything for 14 days because she had the vet said literally it took her 45 minutes to close her. So it was extensive. So, we have to childproof our house for sure. In all of that, it was just such an experience in so many ways because I think of how we don't even hesitate to bring our pets in for these things, yet our patients are hesitating to come into us in the dental practice.
It's
And
so interesting how that is the case. You'd think that we should care, not care, we should value our own health care and value ourselves. I wouldn't say more than because I'm an animal lover too. The same way we value our pets, like we think nothing of doing this. And even pet insurance is not reliable. So if you have pet insurance, it may or may not cover it. And then
right.
regardless, like we don't think anything of slapping a credit card down to the veterinary office, but all of a sudden, And it's twofold. I think patients hesitate putting that money, like, without any question or hesitation into their own dental health. But I think we as dental healthcare providers hesitate in asking for that money or for making that
Mhm.
recommendation for fear that it's too costly to the patient.
Yeah. I mean, the CT blew me away when I got the cost on that, because this is a daily, a weekly conversation I'm having with my clients that are doing medical billing is, and I'm just like, even if you charge just $150, like you have $100,000 machine that you're not getting ROI on that you should, and you want to create the value of that. And if you just do that and you did one a day for a year, you'd have $60,000 in your pocket, and we can bill that to medical. And I understand a lot of these things that we do don't get, we don't charge for them because we know that dental's not going to pay for them. So we feel bad and we don't want to charge the patient. But how do we sustain that model? I mean, my vet, and so we had dental yesterday, and that was another $1,800. So my first visit with Emma was, I have it right in front of me, $540. The surgery and all of that was another 1,800. Fortunately, that's all, actually. That was a really low amount for that invasive surgery. I mean, she gave me a quote, and I thought after knowing how extensive it got, she would have upped her fee, but she didn't kindly. And then now she had her dental done yesterday, and it got up to $1,800, or no, $1,400, you know, and and we complain about our dental fees in dental. I don't really understand that. And certainly when we look at the plans too, I was starting to look at pet insurance, and it's as much as a human dental insurance as well. Um, it's just, I don't understand. I don't understand. I don't understand how, we easily accept our fee schedules of $36 on average for an 0120. My vet's getting 88 right out of the chute. That's just starting. And if I would have went to an ER vet, it was up to 300, and we think nothing of it. Yet in dentistry, we hold back so much. And there's just this mental mindset. I don't know. I don't think we value our own profession very much to think that we don't deserve to be paid as a medical specialty.
That's
Just
really
like my vet,
interesting.
she's a medical specialist, she's a vet. She's like my chiropractor.
Most definitely. So let's talk about that. So I think that we're creatures of habit. And I think that that's kind of a common thing for us as dental professionals. And I think that, when you are comfortable with something and you know something, the thought of bringing in a whole different type of billing is a little bit overwhelming. Different codes. What happens if it's not accepted? What if it changes? What if
Uh,
it's not covered? Then what do you do? I feel like there's a lot of, uncertainty there that I think makes it so people are like, you know what, just forget it. We'll just do what we know and what we can rely on, even if it's not great. What would you tell those people?
well, you're leaving thousands on the table. That's what I would say. I mean, there's so many things that are not maybe on your dental fee schedule that are not covered by dental. And so what I often see is a lot of practices give those away. CTs, exams, bone grafts. I mean, I just had this conversation yesterday with a potential client. They're giving that all away because they just don't want to deal with it. And they're working for peanuts. And I'm just like, dang, the longer I do this and I see what medical claims come back, we see so much higher reimbursement on the medical side. So there's just so much opportunity. There's so much missed opportunity in a dental practice. And I think it's just the mindset of, well, dental's not going to pay for that. And so, the patient only has 2 exams per year. They're here, they're in pain. We're not going to charge them for this one, you know. And there's no medical doctor or vet or anybody else in the medical realm that's going to do that for free. But yet we do it all the time. And I think the biggest breakdown is we have this crazy thing called dental benefits that we've allowed to just dictate everything that we do. We've allowed how much How much do we set our fee schedules at? This is a big time of the year. We're looking at, fee negotiations, fee schedules, and, potentially changing those. And we use this thing called the NDAS. That's awesome. But we're setting it on what's happening in the dental industry, not the medical industry. So it's super low. And we're basing it on, it's all based on and dental benefit, dental insurance. I don't like to call it insurance, it's really not. It's all based on those fee schedules, not medical. Why? Well, how did that ever start?
I don't know. And it's interesting because there is such a push now, especially with sleep dentistry, and there is kind of a little bit more of a crossover, oral systemic health between dental health and um, systemic health, medical health. Even the ADA, in January's DE, there's an article from Marco Vujicic about implementing medical billing into the dental practice. So this is becoming more and more common. And so it seems to me like it's time to either, definitely take a deep dive and learn about it and maybe see what the opportunities are within your practice, but also, you don't want to be the last one that's missing out on all of these, this benefit that is just sitting there waiting for you. So, where can people get more information? Where can people learn more and kind of really look at their, look at their own practices and try to identify the opportunities?
So one way it would be to just reach out to me if you go to my website, tipsmedicalbilling.com. If you go to my resource page, you can look up a ton of videos. A lot of the videos that we've done together are on there, as well as a CE that I did for DOS as well, and that's on there. And if it's something that you want to investigate, shoot me a request for a medical billing analysis. And I'm be more than happy to do that and really take your numbers and do a deeper dive and see what opportunities you have. Even if it's basic things, those things are easily billable, payable. They don't cause a lot of, you don't have to do a lot to get the reimbursement. There's opportunity that I know in every single dental practice. So it's just a matter of taking a look and seeing what's right for you and customizing it to what your philosophy and practice is.
That's fantastic. Well, thank you so much for joining us. And thank you so much for, you know, it's so interesting that you do liken, what we see out in the real world versus what we're seeing in dentistry. So, what a world we would live in if our patients treated themselves so well as you treat Emma and we treat our own pets.
Right, I know. Yeah, we it's kind of like when you have children, you give up a lot of things, whether it's personal time, whether it's money, whether whatever, so that your children can have the things that you want them to have, and you sacrifice yourself. And we do the same thing with our pets, and people do the same thing with coming to the dentist. Um, so how do we change that? And how do we make it doable for people that even don't have dental benefits, don't have dental insurance? You can see them if you're taking medical. So even to the basics.
I love that. And I love the opportunity for us to be able to serve more people and help them get the care
Exactly.
that they need. So, wow,
Right.
thank you so much for this. This was amazing. So, again, can you share your website, contact
Sure.
information, and, for anybody who needs to hear it again?
Sure. It's tipsmedicalbilling.com, or you can shoot me an email at Candra@tipsmedicalbilling.com.
Amazing. Well, thank you so much, Kendra, and I
Thank
can't wait to
you.
see you again.
Thank you.
Thank you. And give my best to little Emma, poor thing.
I will. Thank you.
Okay. All right, everybody. For DE Business Lab, I'm Pam Maragliano Muniz, and we will see you next time.